Perkins.
Okay, my name is Kathy Perkins. I worked for East Texas Medical Center in Tyler. I work at a remote site, which means that I don't actually work at the hospital. I work at a lab down the road. It's on South Broadway in Tyler. I am what's known as a stat lab technician. I actually work with the ER. So I am in and out of the emergency room every day, all day long. You're gonna think this is pretty gross, but my favorite thing in the ER is a chainsaw cut. Whenever you see that big, huge gaping wound, and then it's stitched down to one fine little line. They always come to the lab and get me if there's a chainsaw accident. Yeah, because I'm not normal in those kinds of ways. So I like blood and guts. Hi. So a lab tech is actually a person who, we do work on machinery, but it is in the medical field in that we do CBCs, metabolic panels, we do coagulation studies. We look at all of your body fluids. You never see us, but we are critical in the care of patients in hospitals and emergency rooms. Doctors depend almost 100% on a lab tech for their diagnosis of the patient. They may have an inkling of what's wrong with you whenever you come into an emergency room or whenever you are admitted into a hospital, but you know, you have those phlebotomists that come by and they draw your blood and all that stuff. Well, those guys work for us and they bring us all your body fluids. So we look at blood, urine, spinal fluid. If you have a sports injury, for instance, and you know, have you ever seen where like your knee or something would swell up and it would have like tons of fluid in there and they take a huge syringe and draw that off? They bring that to us to look at, to see if it's infected, to see if there's any crystals in it. So we look at everything on the inside of you. We don't ever see you. Even if you come into the emergency room and we come into the room, you're probably not going to know that we are a lab tech unless you read it on our little deals that we wear with our name tags. So what a lab tech actually does is whenever they bring us, it's a girls, you're going to like this, it's female predominantly, or maybe guys you might like it better because it's predominantly females that work in the lab profession. I don't know why, but it just is. And they bring us whatever body fluid. Just say you come into the emergency room with a fever. Well, that fever could mean anything. So they'll draw your blood and they'll have you pee in a cup. And then they're going to bring those fluids to us. We actually spin those fluids down in a centrifuge. We put it, I have a picture of a chemistry analyzer and a hematology analyzer that we use. Our hematology analyzer is fairly large.
For those of you who came in, this is Kathy Perkins, Lab Tech, okay? We need our notes. I'm gonna grab those.
Okay,
Get your
so I don't know if y'all can see this, it's kind of small. But this is our chemistry analyzer. And what we do is we put your serum or your plasma that's been spun down out of a tube onto this machine. And this machine runs metabolic panels on you. So a metabolic panel is something like sodium, potassium, chloride, CO2. It does liver panels, it does pancreatic studies, it does drug studies, just anything that we want it to do. So what we do is we put it on the machine, Everything is barcoded now in the hospital. From the time you walk in until the time you leave, people will be scanning the barcode that's on your wrist. And so that barcode translates over to our laboratory, and then we label all of your tubes that are brought in, everything, with your name. There can be no mistakes for the simple reason that your life depends on what I do. So if I make a mistake and say, I label your CBC tube with her name, then all the results go to her. And the doctor makes a diagnosis on her based on your blood. So there can't be any mistakes. Now, that saying, we are human, and there are mistakes that are made. But we try as quickly as possible, especially in the emergency room, to rectify that. So if I see that I've mislabeled something, I immediately pick up the phone and call the ER and say, don't pay attention to this or that person, because it's all wrong. But a CBC is, we use whole blood on that, and it is a thing to find out whether your infection or whatever it is viral or bacterial. So viral is a left shift, that's what it's called. Bacterial is a right shift. So that means that certain cells are going to be more in one than in the other. In a bacterial infection, you're going to have more of a neutrophilic thing, and in, y'all don't understand any of this.
We're like, oh, get
But
that
in a viral, it's going to be more of a different leukocyte. So we look a lot underneath microscopes. We look at parasites. I was always the one in school that said, what are the odds of me seeing a Chinese lung fluke in Tyler, Texas, whenever Chinese lung flukes are in China? What are the odds? Well, guess who saw a Chinese lung fluke in Tyler, Texas? Brought in by a native from China. And so I was always the one that said, how am I going to see malaria? I don't live in the malarial belt of Africa. But yet I diagnosed my first case of malaria as a student in Tyler.
I had a parasite once that they were like, this is like usually only in third world countries.
Yeah, probably a giardia is probably what it
I don't
was.
remember. It made
They
me
are really cool
sick.
looking little creatures because if you look at them underneath the microscope, they're this shaped, and it looks like they have big eyeballs, but actually those are suckers that connect themselves to your intestine. Yeah. Yes, sir.
Don't parasites suck out blood and stuff?
It's according to what they like to eat. Some of them do blood, some of them do spinal fluid, some of them like the stuff on the inside of your lungs, some like your liver, and some like your kidneys.
When you was talking about like sucking fluid out, athletes and stuff, you meant like, what's that thing, oxen saliva, what's it called? That fluid that being in your food.
Like on your knee or something?
Yeah.
Yeah, it's why you put me on the spot?
It's something saliva.
No,
No.
no.
Oh.
I know what it's called, I'm blank.
Well, it's a big word, it don't make no sense.
It actually does if you kind of know a little bit about Latin, because we always say that things are named after whatever weirdo found it, because you'll find that some things are named after people. So I always say some weirdo was looking underneath a microscope somewhere and something swam across and they said, wait a minute, what was that? And they looked at it and they named it after themselves. So you do find a lot of diseases, a lot of parasites and stuff are named after either where they're from or who found them. So anyway, we do all of that. All those results get shot back to the doctor. Your CBC, your metabolic panels, and your UA, your spinal fluid, your coagulation study. A coagulation study is see how your blood clots. So if you're in the hospital and they're giving you heparin, they'll do a PTT on you to make sure that you're not gonna bleed out, because your blood is what's called thin. That's not actually correct. It's actually anticoagulated, but that's a big old word. So lay people say it's thin blood. But we do all of that. It all shoots back to the doc. He picks up those reports and he looks at it. And if it lines up with what he thinks is going along with you, then he will diagnose you with what he thought. If it's not, if he's thinking, say, you're having liver trouble, but your liver panel comes back fine in the normal ranges, then he's got to rethink his diagnosis. So we're, even though you don't see us a lot, we're a very integral part of what goes on in the hospital. We also do quality assurance in the hospital, which means that all machines in the hospital, we go around with a swab and we swab those machines, and then we grow whatever funk is in that machine. And that lets the hospital know we go from the cafeteria all the way through to maintenance. So that lets them know if there's any unusual bugs in anything that they're doing. We especially don't want bacteria or viruses growing in the salad in the cafeteria. So they go through once a month and they swab certain departments, and then those things are grown out for probably a week. And then if nothing grows, then it passes inspection. If something grows, then they have to go in and clean. And of course, I call it their drug of choice to clean with is bleach. That's a reason that hospitals have that odor when you walk in. Yes, sir?
What college did you go to?
I went to Tyler Junior College. It's a 2-year program. My advice to you is to get your basics out of the way first before you start the program, because the program is hard. I'm not gonna lie to you. We were told whenever we went to take state boards not to freak out at the first or second test. Question. So when I went to take my state boards 25 years ago, I read the first question and it was something I'd never heard of. And so I'm like, okay. They said, don't freak out, don't freak out. So I read the second question, which pertained to the first question. And since the first question didn't make any sense, I was beginning to kind of freak out a little bit. First 5 questions on the state boards was about the first question. I had no idea what they were talking about. So I was really freaked out by the end of the time, because then we took paper tests on a Scantron. Now they do it electronically. But I was really freaked out because those 5 points could be pass or fail. And so as soon as I got through, I ran outside to all my friends who were also taking the test, and I was like, what was the first question? They were like, we don't know. So they were like all freaked out too. Well, come to find out, they had taken the genus of one organism and the species of another organism and put them together. There was no such organism as that. So they had to throw out the first 5 questions, which we were like, yes.
So the question didn't make sense.
No, it didn't make sense because there was no such thing in the whole world. So, we were told crazy things whenever we were in school, like you couldn't paint your nails, girls, or have acrylic nails. That's not true. You can paint your nails. And I don't know what they thought painted nails was going to do to a lab test. Maybe whenever they were doing it by hand, it made a difference. But everything in the lab nowadays is automated. So you really have to know what you're looking at. remember one of my first patients came in, they were comatose on the stretcher, and they do pain tests. Have y'all ever seen a nurse or anybody do a pain test? They take their knuckle and they put it right here on this muscle and they push it down really hard.
Did that work?
And this guy didn't move. So then they took his skin with their fingernail and they twisted it, and he didn't move. And we were like, oh, he's in serious trouble. So we went back and I did the labs on him. His glucose was 5, supposed to be 80. His was 5. His little wife, he was diabetic, and his little wife had been giving him insulin even though he hadn't eaten in 3 days. She was giving him that insulin now. And so he was in a diabetic coma because she kept shooting the insulin and he had nothing to it. So
But see how important her job, I mean, like someone comes in, they're passed out, you have no
I
idea.
had no idea.
But her test that she knows how to read
Yeah.
will give you a quick answer.
Right, and so within probably 10 minutes, they had an answer to his problem. They gave him, they have this stuff that looks like syrup, and it comes in a 50 milligram syringe. It's about that big around, what holds it, and it's syrup. And they shot 3 of those in him before he even went, 3. It took 5 to get him out of this. So there's 50 milligrams of thick sugar that they just shot in this guy. It was awful. It was awful. Things like that are pretty scary whenever you see them in the ER. And thank God for nurses